Presentation is on laser therapy for conjunctival lid and orbital pathology. This was a retrospective case series which we had done to know the use of YAG laser as well as to know its outcome. This was a retrospective case study which was conducted on 970 eyes from a period ranging from December 2015 to June 2017. The patients were aged from 14 to 75 years and all presented with an ocular pathology. They were followed up for a period of 6 months with weekly visits in the first 1 month and thereafter monthly visits for the next 6 months. All those patients required a repeat laser or showed recurrence of the pathology had to be excluded from the study. As soon as the patient came, we took up a detailed ophthalmic history and an evaluation was done. The patient with ocular pathology was given a local infiltration of lignocaine and seated in front of the slit lamp. And using the slit lamp double frequency enhanced 532 nanometer ND YAG laser was applied to the lesions. The lesions over the eyelid are cleaned with betadine. And all the pterygium cases were given post-laser topical steroid as well as antibiotic for a period of 1 week. The data so obtained was coded and entered into Microsoft Excel sheet and analyzed using SPSS version number 22. A total of 970 eyes were studied, out of which 124 had to be excluded because they met the exclusion criteria. This was a statistical analysis. The age which showed that the maximum ocular pathology occurred in the age group of 31 to 40 years, with the youngest patient in the age group of 14 and the oldest patient of 70 years. This was a sex distribution which showed a slightly higher female predominance among the ocular pathologies. These were the range of diseases for which we applied laser, which included wart, pterygium, molluscum, papillary cyst, and other conditions such as feeder vessels, hyperpigmented scars. The complications were noted one. The only complications recorded was the ones with pterygium, which developed a redness in the post-laser period and which recovered with antibiotic and steroids. And all the patients were evaluated weekly for the first 1 month and therefore monthly for the next 6 months. 124 eyes showed a recurrence and thereby was excluded from the study. Here we used an ND YAG laser, whose host medium for the laser was yttrium aluminium garnet with a 1.5% impurity of neodymium ions. And these neodymium ions served as lattice sites as substitution impurities and provide the energy levels for both pumping as well as lasing transitions. The ND YAG laser has a wavelength of 1064 nanometer with a frequency doubled to 532 nanometer. These were the prior studies in this regard, which include the ones by Moskalik et al., who studied the effect of YAG laser on benign facial skin cancers. Here, in our study, we have included 152 eyes with wart over the eyelid, which was successfully treated with laser. This was a case of keratoacanthoma, which we treated with ND YAG laser. Another study by Omi et al. Showed that recalcitrant molluscum contagiosum could be successfully treated with ND YAG laser, but compared to the 7 case study in Omi, we had done a 135 eye case study on molluscum contagiosum. The youngest patient was 14 years, single treated, and with no recurrence. This was a case of molluscum contagiosum, which was treated with the ND YAG laser. Nakamura et al. Showed the usefulness of erbium YAG laser and pterygium. Here, in our study, we have used ND YAG laser for 186 eyes with pterygium, and the patients were followed for 6 months with no incidence of recurrence, and it was based on the coagulative property of ND YAG laser. This was the pterygium case for which ND YAG laser was applied and the post-laser 4 months picture. This was a 6 months picture post-laser. Amir Hossain Sadat studied the incidence of colloid milium, which was caused by the exposure to intense sunlight, and it was successfully treated with the erbium YAG laser. These were the miscellaneous conditions for which we applied YAG laser, which included cysts, chalazions. Café spot was also successfully treated with YAG laser in studies by Kilmer et al., Grossman et al., and Levy J. et al. This was a case of cyst which we successfully treated with post-laser. This was an electrolysis which was done in the lower lid using ND YAG laser. A wart being successfully treated with post-laser. This was a series of pictures for which we applied YAG laser on a cyst and the final outcome. 304 eyes with miscellaneous conditions like feeder vessels and hyperpigmented scars, etc. were successfully treated with YAG laser. This was a case of multiple nevus treated with the laser. And this is an ongoing study where all the 846 eyes are being monitored monthly for recurrence as well as for complications. Until now, the patient tolerance was good and no recurrence is being reported. 124 eyes required repeat laser due to the poor regression and was thereby excluded from the study. And hence, I would like to conclude that YAG laser is emerging as a safe tool for dermatological lesions around the lid, and the ease of performing it as an OPD procedure with a good safety margin, minimal bleeding during the procedure warrants its use as an aesthetic ophthalmic laser. Thank you so much for the press.
Any question from Dr. Meenu, please? Dr. Meenu, you have said twice in your study that you excluded the patients with recurrences or complications.
Yes, sir.
So what is being studied then? If
Sir,
the patients with pterygium recurrences are excluded from your studies,
yes, sir. We had included 970 patients with the ocular pathology, and all those required repeat laser was excluded from the study. That include, but
what is this study for?
it is for the outcome of YAG laser.
Naturally, if there are recurrences,
Yes, sir.
the incidence of recurrences is not known because you are excluding those patients. Maybe all 100% are having recurrences over a period of time.
No, sir. For 970 patients, we applied YAG laser, and 140 had to be excluded. That was just a statistical analysis. We applied laser for the 970.
20% of them have recurrences or complications.
Yes, sir. And but we that 124 was excluded from the study, but for them YAG laser was applied, and because there was a recurrence, we didn't include in the statistical analysis.
Overall, in the pterygium, how much recurrences we have seen in how many % of patients?
So pterygium was among the case study. The pterygium showed the maximum number of recurrence, and that was about 30% recurrence. After the 124 eyes, 30% was pterygium.
Quite high. Okay, thank you.
Thank you.